Doctor, thank you very much for joining us. It's really great to have you with such an extensive experience of 35 years and 22 years of experience in UAE. There is a lot to learn and a lot to understand, and from you a lot of information. You've got Doctor. Once again, I would just like to tell you that Dr. Joshi is in Prime Medical Center, Jumeirah. He's currently practicing there. So if you want to book an appointment, you can book over the call with Dr. Joshi. As Dr. Our today's topic is importance of healthy weight for your child. That is really really very important. As I just said, that a lot of administrate parents and school administrators, they've all reported a lot of weight gain among children, likely driven by unhealthy diets. Doctor, stress is there, then limited physical activity is there. With coronavirus likely to be an integral part of it, doctor. So collectively, collective foreseeable future, we would like to know what trend you see these days, doctor.
Good afternoon. Thanks for inviting me. I'll be talking mainly about nutrition in children, and today's discussion will be limited to the children with overweight rather than underweight, because normally we say a child gains about after the age of 2 years, he gains about 2 to 3 kilos in a year. But recently, since the onset of pandemic from say March or April into July, I've been seeing children who come with weight gain of almost 1.5, even 2 kilos in a month. I've seen children who have put on almost 8 to 10 kilos in last 6 months, and this is really alarming. And definitely that will lead to obesity. And that's the main concern today. And I'm going to discuss more about obesity rather than undernutrition or malnutrition. Obesity, of course, I'll just give a brief about obesity. It's a medical condition where the child's body weight is in excess of what it should be according to his age or his height. Now, normally what we do when a child comes to us for a visit is we take his height, weight, of course, note down his sex, and plot the weight on a graph. This is known as a growth chart. Now, in growth chart, mainly when we plot weight, normally a child follows one line, say 5th centile, 10th centile, 15th centile, 25th. So the growth chart is between 5th and 95th centile. Centile, percentile. When I say centile is percentile. Percentile means the number of children of same age below that level. So, for example, if I say a child is 50th centile, means half of the population is below his weight. So that's an average 50th centile. 95th is the upper limit, and 5th is the lowest limit of the weight. Now, a child who is weighing more than 95th centile can be overweight or can be obese. Now, this weight, we always have to consider in relation to his height, because weight can be higher in a child who is tall. So always what we need to calculate is the body mass index. Now, just weight, just height, this you can plot on the normal charts. For the body mass index, you have a special chart known as BMI chart. Now, adults must be aware of BMI. BMI or body mass index is the measure of your body mass or weight in relation to your height. Now, if you want to calculate, there is a simple formula: weight in kgs divided by the square of height in meters. So, for example, I will discuss about a child. A child who is say 2-year-old is weighing say 16 kilos, and his height is 90 centimeters. 90 centimeters is 0.9 meters, right? So the formula will be you have to divide 16 by 0.9 square. 0.9 square will be 0.8. So 16 divided by 0.8 will be about 20. So the child BMI is 20. 20 is high. In adult, you must have heard that 24 is high, 27 is very high. In children, average is about 16.5. If you add 18.5, two more, 18.5 is the higher side. 18.5 to 20.5 is overweight, and more than 20.5 will go into obesity. So that's how the BMI is calculated. Of course, you don't have to remember the formula. Nowadays, you can Google it. When you Google for the BMI for children, there are calculating graphs available, and you put the baby's age, baby's sex, height and weight, and automatically it will give you the BMI. Remember, 16.5 is the average, and that's the target everybody should have for the children. Of course, we have BMI charts available where we actually calculate the BMI of the child and plot it. Normal ranges between 5 to 85th centile of BMI. Any child who is below 5th centile underweight. Any child who is above 85 is overweight. 85 to 95 is overweight, 95 and above is defined as obesity. So in general, any child whose BMI is more than 95th centile at his age is obese, and obese needs definitely a treatment. Underweight is something where you notice and give proper nutrition, diet advice. They may pick up and become average. When the children are going overweight, that's the time you should really concentrate on this diet, increase the activity, and make sure they don't go into obesity. Because obesity is associated with lots of complications, not only in pediatric age group, but as the age increases, obesity predisposed to many of the medical conditions. And one thing I must emphasize in pediatrics is this. Adult like you and me, when we put on weight, is the size of our fat cell which increases. It can increase to double its size, but you start dieting, it will come back to normal. Whereas in children, when the obesity develops, is an increase in the number of fat cells. So when the number of fat cells increases, it will never come down. So a child who is obese in infancy or first few years of life invariably becomes obese as an adult. So it's very, very important that we concentrate on child's weight very early in life.
Great. Thank you very much, Doctor. I'm sorry, I've got some comments related to clarity of voice and video we might be facing because of the internet at this time. Please bear with us. We're fixing it during the live session. Doctor, I have another question coming in. Factors contributing to pandemic weight gain in children. What is the trend you notice? Do parents need to be careful about?
Definitely. Because what's happening is, in pandemic, most of us are in house, either on internet, learning from home, parents are working from home. So most of the time the activity is much less. And when you are not very active, you tend to eat more. So of course, eating more, eating junk foods, eating fast foods, frozen foods, and lack of exercise. Both this lead to an increase in the weight gain, and which is, as I said in the beginning, going to very alarming proportion. Children gaining about 1 to 1.5 kilos every month. Of course, it will lead to obesity if we don't tackle it now.
Thank you very much, Doctor. Doctor, can there be a medical reason for underweight or overweight?
Yes, definitely. See, medical reasons account for many of the cases of obesity or underweight both. Medical reasons can be right from the nutrition. If the child has some problem due to which he is not able to eat very well, swallow, or has some problem with the cleft lip, cleft palate, things like that, the child cannot eat very well, or then it can lead to undernutrition. There are conditions where the child eats well, but the absorption is not very good. One of the conditions is celiac disease, where there is a gluten-sensitive enteropathy. Means babies' intestines are sensitive to gluten. So whenever any food which contains gluten, the lining is destroyed and the absorption is not very good. So then whatever he is eating will not be absorbed, which will lead to various deficiencies underweight. Even after he is eating, if he has a chronic disorder, say chronic liver disorder, some underlying heart problem, heart diseases, ventricular septal, or any of the septal defects, then also the weight gain is not going to lead to undernutrition. Of course, the weight of a child is not only what he eats, what he absorbs, what he metabolizes, but plus his endocrine factors like his hormones, growth hormone, thyroid hormone, other endocrine hormones which are important to build up your system. So like adrenal hormones, all the hormones have to be proper for a child to have a normal growth related to nutrition. Whereas obesity, the main reason is, of course, increase in the food intake. The second is lack of exercise. Then there can be psychological factors. There are some children who are stressed, and when they are stressed, they keep eating and they overeat and they become obese. Some children eat more sweets when they are stressed and they eat. Psychological factors are there in children. Of course, social factors are also there, like socio-economic conditions. There are people who are, spending a lot on junk food. Their fridge is full of all the junk food, all the cold drinks and ice creams and frozen foods, which can lead to obesity. So social factors are important as well.
Great.
And of course,
Thank you.
family factors. If the parents are both obese and they themselves are not taking proper healthy meals, they can lead to obesity.
Right, right, doctor. Doctor, how do parents know if the extra weight is affecting the child's health? When should they consult their pediatrician?
Right. See, normally, if you are going to a pediatrician regularly, you normally have a weight chart. It tells you where the child is going. Is he on 50th centile or 70th centile or 80th centile right from infancy? If he starts suddenly increasing weight and he jumps the percentile, say from 50 to 70, likelihood is that he is going overweight. 70 to 90 is going over 90, definitely is going into obesity. So one thing is that he is jumping on the percentiles on the chart. Second, of course, a child who is obese becomes less active. It's most of the time sitting up. That leads to obesity, and obesity also leads to inactivity. His sleep pattern is disturbed. He doesn't get proper sleep during night and keeps sleeping during daytime, and his activities become less. And another thing which I noticed, if you put on weight suddenly, is you start snoring because the weight collects in the soft tissues behind your breathing pipe and the pharynx and the larynx, so that can lead to snoring. So these are things, of course, which tells you that the child is going on overweight. Of course, his appearance is become rounded, the tummy is bulging, all these other things of overweight.
Great. Thank you for this information. Doctor, I've got some other questions here. As a pediatrician, doctor, what are some of the most common questions you hear from patients and their family right now? Like, what's your advice to parents in general? How susceptible or are children to, to COVID-19?
COVID-19, of course, all of us are susceptible because the immunity has not yet come, natural immunity has not come, the vaccine is under trial, and when everybody gets the vaccine, there will be good immunity. So everybody is susceptible. The question is whether children are more susceptible than adults. So far, the children were staying home, and they were not hardly getting exposed to the environment, so they were not very susceptible. As the lockdowns have opened up, people are going out shopping. I see children going to restaurants with their parents. The schools have opened up, and then they will get exposed to more and more cases of corona, and chances of them getting are more likely. So, of course, the crowding, as we said, should be avoided. When they can wear masks, they should wear the mask and teach them sanitization. I've seen children listen very well to their teachers and, of course, to us doctors and a little bit to their parents also. So, yes, we have to teach them that all of them are susceptible and they have to take precautions and maintain good nutrition. What I tell my patients is, normally they say one apple a day keeps doctors away. I tell them one apple a day keeps corona away. You need doctors for your normal nutrition and vaccines.
Right. That's right, doctor. We need doctor for the nutrition, especially when you talk about children. And that's right, that you need an apple a day to keep the corona away. Doctor, I have a question here coming in from one of the members who registered for the live session. Should I cancel my child's upcoming well child visit, regular checkup vaccination, if he or she is otherwise healthy?
Well, I will not recommend that. You need a normal healthy checkup for children, especially infants. Very important. First 6 months, we say almost every monthly visits, not only for growth and development, but for vaccines, feeding advice, all that. 6 months to 1 year, every 2 months. After 1 year, every 3 months, and after 2 years, once in 6 months. So that advice will continue even during pandemic. We are taking precautions when you come to us, and we advise you also to take precautions like wear mask, sanitize your hands again and again, and concentrate on nutrition. It is safe if you take we all take precautions. It is safe to really visit the doctors, and it is required. But I see that many children have missed their primary vaccines. Some of them are not given it on time. When the vaccines are not given on time, we are not very sure how good will be the immunity. The boosters are very necessary. If you don't give boosters on time, the primary vaccines will also be of no use. So 18 months boosters, 5 years boosters, these are necessary and should be seeing the doctors.
Doctor, there's a question from one of the parents saying, how can we prevent cross contamination of the virus in children? Cross contamination of the coronavirus, maybe, in children.
Probably they want is transmission of the virus, right?
Probably it should be, I believe, transmission. It should be transmission, exactly.
Yeah. See, whenever there is any doubt, any child who has got cough, cold, fever, headache, body ache, blocked nose, change of smell, change of taste, these are the symptoms which can be of corona. The child should be staying home, visit the doctor. Doctor will clinically check, may carry out the test because tests are the only way you can rule out corona. Doctors cannot examine just throat or with the stethoscope and say this is corona, not corona. So that is necessary. And once you are suspected or diagnosed, you stay home till the symptoms clear or till the diagnosis is clear. And then you go to school, you will definitely prevent the transmission.
Right. Doctor, there is a question from a mother where her child is asking her, Mom, why is my diarrhea stinky? So, what do you have to say about that, doctor?
Well, okay, we are diverting away from this obesity topic, but yes, everybody's poo is actually stinky, so there's nothing to really worry about just because of this thing. Any child who is eating more of carbohydrates, starchy foods, the starchy foods get fermented, and fermentation leads to formation of gases, and that leads to formation of cements.
Right.
Of course, stool check can be done for lactose malabsorption. We can rule out the worms and treat it accordingly. Most important is go less on sugary foods.
Great. Doctor, when you talk about obesity in children, there is something what I understand is a role to play of is the portion sizes of the food. How do you say, what about the portion sizes? If you can just explain a bit, what should be the portion?
Normally we see that they recommend, like in adults, children also, 4 to 5 major meals rather than 1 or 2 like heavy lunch or heavy dinner. So 4 to 5 meals are advisable. And portion should be, the volume wise, it should depend upon the child's age and child's weight and child's capacity. You should never force the child that, okay, I cook so much and child has to finish it. No. And the portions have to be decided as to fruits and vegetables in one portion, which includes soups and rice cereals, wheat cereals. So we want to give a balanced diet. Of course, dairy products, milk, eggs, meat, almost every day. So a balanced diet contains enough of.
Great. Doctor, I have a question here coming in directly. I'd like to show it on the screen also. Can lack of vitamin D cause weight gain?
Not really. Vitamin D is very important for almost entire all functions of the body, including your growth of the bones and mineralization of the bones, your immune system, your hormonal function, everything needs vitamin D. So yes, so one thing I have observed is obese children have more likely to they are more likely to have vitamin D deficiency. And they do have even bony osteoporosis, and obese children are more prone to fractures also. So it's other obesity can be associated or can lead to you probably develop genetic cause of obesity. Yes, obesity genes have been identified. I mean, human beings almost about 50 genes, if I'm not wrong, have been identified which can lead to obesity. Genetic causes of obesity form less than 10% of all the cases of obesity. 90% is because of faulty foods and lack of exercise. And between two, 80% of your weight is because of excessive food and 20% is because of lack of exercise. So both the things have to be, mainly the diet has to be concentrated when you're looking at obesity. Yes, obesity genes are identified, but normally we don't recommend it. There are certain genetic conditions when the child presents with obesity. There is a condition known as Prader-Willi syndrome, where there is a abnormality in one of the chromosomes, chromosome 15, and this child keeps eating. Day and night he's very angry. In fact, the parents have to lock the fridge. He eats all the time and he tends to put on weight. In fact, it's one condition. There are other genetic conditions. Biddle-Barrett syndrome is one where they have extra fingers, they have kidney abnormalities, and they put on weight. There are lots of chromosomal syndromes, like Down syndrome children have obesity, Turner syndrome, where one of the X chromosome is missing. There also. So yes, genetic causes are there, but not very common.
Great, doctor. Thank you very much. Doctor, I have a question here. Mr. Vijay is asking, hi doctor, my one query is my son is 2.5 years and his weight is around 12 kg, but he doesn't bite the food and directly swallows it. Please advise.
Of course, the weight for 2.5 years, we have to look at the birth weight. Say if the birth weight was 3 kilos, it doubles in about 4 months, so becomes 6 kilos in 4 months. By 1 year, around 9 to 9.5. 2 years, about 12, and say by 3 years, it should become about 14. So he is a little bit on the underweight side. Of course, I will have to what his height and weight and look at his BMI to say whether he and of course, the cause is very obvious. The child is not chewing well, and that's the reason why the intake of food is not good. And of course, this is majority of underweight children. This is the common complaint in Dubai. The reason is, the best time to train a child to eat normal solid by chewing is about 8 to 9 months. That is time, parents usually start blending everything and give everything as a soup or as a liquid rather than allowing him to learn to chew. Sucking and swallowing is something which they do even before they are born. But chewing, making a bolus and swallowing is something they have to learn. So I will recommend that at the age of 7, 8, 9 months, when you start the solids, instead of blending it totally, start giving hand mashed or spoon mashed food and let the child swallow. Learn to chew and swallow. If you have this child of 2.5 years has missed the boat, but still not late, they should stop blending everything. Even if the child is not eating, the child probably is eating the chips and French fries and the biscuits. He's biting, but he's not ready to bite normal food. Probably is something to do with training rather than any medical cause, and it can be corrected with proper nutrition.
Great, doctor. Thank you. Doctor, I have a question that's related to flu and COVID. If a child exhibits flu-like symptoms, how do parents know whether the child has COVID-19 virus or it's a flu or a seasonal cold? What is your advice on how to handle it?
Yeah. The seasonal colds usually come with a little bit of sneezing, runny nose, mild fevers, and whereas you look at corona cases, they have nose block, not runny nose. They have, if older kids are there, they will say they cannot smell very well. The taste changes. Both of them can have fevers, both of them can have headache and body aches. So the symptoms are overlapping, and that's one of the reasons why we say if you have flu-like symptoms, whether it is corona, whether you have flu, you stay home. If it persists for more than 2-3 days, so visit your doctor, who will probably check you, advise some initial tests, and may need to do a corona test. Corona test, I must tell you that it's not positive very first day. I see children very brought to me with high fever, and they expect me to do a corona test. I say no, you wait for 3 days, 5 days. They most likely time of getting a corona test positive in a child who is suffering is around 5th day after the onset of symptoms. So till then, it should be stay home and take treatment symptomatic.
Fine, doctor. Doctor, there's a question. Does my family need to change their eating habits to encourage my younger kids' choices?
That's very important. In fact, children learn from their parents only.
Okay.
The first, exposure to food is with their parents, right? So after the age of 6 to 6 months, first 4 to 6 months, normally we say breastfeeding or milk-related feeding is most important. After 6 months, we start weaning, and that's when we introduce the solids. And we say 1 or 2 solids a day in the beginning. Don't start with many things. Don't start with mixed items in the beginning. Every 3rd or 4th day, increase one item. And towards the end of a month, we expect a child to be taking about 4 to 5 meals, fruits and vegetables, rice, cereal, wheat cereal. Now, all that parents have to start early, and of course, the family, if they eat together and parents show what they are eating, healthy food, children will usually follow the parents.
Right. So that's very important, actually, I believe. Right, doctor? Doctor, if you talk about snacks, what is a healthy snack for a child? Snack.
Healthy snack, of course, it has to have a dairy product, which can be milk, it can be yogurt, it can be cheese, and fruits. Any fruit, apples, strawberries, banana is very good. These are all, they can give calories as well as vitamins and cereals, which can be full of carbohydrates and proteins. So, cornflakes, good. Brown bread or wholemeal bread with some butter, and if the child is allowing some salads like cucumber, carrots, lettuce, lots of things you can.
Right. Doctor,
the variety should be offered in colorful.
Colorful meals, yeah, exactly. Doctor, I have a question here, which is a bit of similar to one you answered earlier, but there is a change in it. My son age is 6 and his weight is 17.5 kg only. He hates eating food and avoid chewing it and keeps in his mouth. This is happening for the last 2 to 3 years. Your advice?
Has probably not been trained properly to chew, and that's one of the reasons why many children do that. They hold only in one side of the mouth and they keep collecting the food instead of chewing till the time the really starts swelling, and then they either spit it out or they refuse to eat or vomit out. This is basically a training related issue. Again, weight is quite less. A 6-year-old, I expect around 20 to 22 kilos of weight. We have to check the child and check whether his height is also on the lower side, and offer him some counseling. He has to be taught how to chew on one side for 5. I normally tell them count of 5 on right, count of 5 on 10, make a bolus and swallow. You have to talk to him and encourage him to chew rather than get angry and scold the child. Don't keep any distractions when he's eating. Like a child wants a television, wants a mobile, you tell him, okay, you finish the food and you will get it immediately. If you don't finish, you won't get it.
Okay.
Strict. And most of the time, this happens in family where there are more than 2 people looking after. More common in joint families because there is multi-parenting situation. Every parent has a different view. One person says, okay, do this, other says no, and child takes care.
Okay, understood, doctor. That's actually a very informative answer you've given. Thank you, doctor. Another question: my 9 months baby is tries to vomit every time while trying for first attempt when feeding solid food, 9 months baby. Is it normal? And what do I do to get cough out for my baby?
See, 9-month-old definitely should have learned little bit to chew. Of course, they can't chew like adults, but yes. So my advice is not to offer him all blended foods. Give him soft foods, little bit crushed and mashed, but not blended totally. Many children have these hypersensitive pharynx, so when the food touches it, they go into gag and they vomit out. But that again, by continuing to feed solids, you will definitely overcome. There's no medication for that. It's only training and time.
Great. Doctor, this question is related to vaccine actually. The question says something like that. My past time has passed for 18 months vaccine for the baby actually. What should I do now? Can I bring my child to put an vaccine this month or give me suggestion actual vaccine date for my child? On the actual vaccine date was probably 3/4/2020. That was 3rd of April, I believe, 2020.
So
So
18-month vaccine, can wait till the age of
understood, doctor. So doctor, they should they can come
they
in.
must take before 2 years.
Okay,
2 years
okay,
of age.
understood. Thank you for that, doctor. I just have one more question. As we are moving towards the end of the session, a couple of questions more. How can we cover vitamin D for kids nowadays when not able to go out from home?
See, if you have a balcony and you are getting sunlight, of course, 20 minutes of sunlight, either in the morning around 8 o'clock or afternoon 4 to 5, where you have slanting rays of sunlight. They have UV light which can convert your fat into vitamin D. So that's the time, 20 minutes of exposure. Children, of course, are wearing the short sleeve clothes and the legs are also open. That's more than enough to maintain. But if you have a deficiency, it has to be checked and has to be treated. A child who complains of, say, severe leg pains, bone pains, he has been staying home all the time. I will recommend that you check for the vitamin D and treat if there is deficiency. Otherwise, maintenance you can get it from the sunlight.
Great. Doctor, I have a question. How do I positively speak to my daughter about weight gain without making her too self-conscious?
That's very important. Because many times what happens, parents also start bullying the child, saying that oh you fat so and whatnot. So yeah, definitely no. You have to just show the child you are putting on the plus side. And this is what you should have gained. You're gaining so much, and this is mainly because your eating habits are not good. Our parents also make sure that you don't keep junk food in the house, cold drinks and aerated drinks not to be there, ice creams also out. Frozen food should not be given all the time, and encourage healthy food and exercise. And let me talk a little bit about the exercise. There are lots of nice YouTube videos available about the fat loss in children, where there are simple exercises for about 15-20 minutes. They do 2-3 times a day. It will be very helpful.
Great. Thank you, doctor. Doctor, I have a question here from Ms. Anna Missing. Is it okay to give banana every morning to the children?
Yes, banana is good. It's a good fiber, good carbohydrate and sugar, which can maintain your sugar for a long time. Banana is good, healthy, almost every day they can.
Great.
About these BMI charts, I forgot to mention that there are very good apps available on the Play Store. You can just write BMI for child, and there are apps available where you put your child's height, weight, age, and sex. Automatically, it will calculate the BMI, and you have the ribbon-like thing available at the bottom. It tells you whether your child is in the green zone or going toward the obesity side or going toward the underweight side. Very good charts. You can use them. If the child is falling off any one of those BMIs, definitely use treatment.
Great. Doctor, I have a question for Ms. Sita Raj. How to avoid early puberty in girls?
Well, early puberty, the age of puberty in girls in Dubai is around 10 or as early as 9 years. So Of course, we don't recommend any hormonal treatment, self-medication. Right? If there is a condition which is causing precocious puberty, that is before the age of 9 years, we need to investigate, find out what is the cause, and treat accordingly. But we don't advocate to play with their hormones. Yes, no. Other thing, of course, regular exercise always leads to your endocrine normalcy. You know? Yes, regular exercises are very important.
Great. Doctor, can you please advise us some healthy foods, not weight gaining food? This is a question from Ms. Sabika.
Fruits and vegetables. Fruits and vegetables. So eat any fruit. Most of them are, very healthy. They will not lead to any obesity or any excess of weight gain. Lots of vegetables, especially greens. Definitely, they will not cause any obesity. Soups, large amount of soups. If you have, I will recommend that every day you should have soups first. When you fill in your stomach with the soups and salads, then you tend to eat less of main portions. Fatty foods, deep fried items, butter, ghee, to be avoided definitely in excess. Of course, 1 teaspoon of ghee or butter in a day is recommended nowadays. For more than that is not recommended. So, and of course, avoid junk totally, which includes burgers, pizzas, chicken nuggets, very popular among children, but they cause lots of obesity.
Doctor, we've got a lot of questions talking about weight. I'll just take two of them. My 4.5-year-old weighs 17.2. Is it proper? And my 22 months old is 11.5. Is that also proper?
11.5 or 22 months, I would say it's okay.
Okay.
And the other one?
4.5-year-old weight 17.2.
That's
Okay.
also okay.
That's fine
Nothing
also.
nothing to worry. Of course, we have to have a look at their height and check whether height and weight both are on the same centiles. If the weight, say height is on 10 centile and weight is on 75th centile, then it is on plus side. So in that case, we'll calculate the BMI and plot the BMI.
So that means it's actually
It can be normal.
okay.
It can be abnormal. You have to look at it.
Doctor, some children are having stomach pain, but they do not feel hungry. This is a question coming in from the members. So, what is your advice on that part?
Right. The stomach pain is very common in children. Like you and me, when we get bored, we have headache. Children, when they're bored, they complain of stomach pains. And that's very common. But then, of course, not all children will have boredom as a cause. You have to look at the child and find out what other causes are there. One is worms or helminthiasis. And the children have worms like roundworms, hookworms, pinworms in their intestine, which can lead to stomach pains. So they have to be treated with deworming. In India, we do it almost every year. Here, we do whenever they come with symptoms of tummy pain. Demonstrate worms in the stools by doing the stool check.
Great.
Of course, there are lots of other causes of stomach pain and or abdominal pain, and the child has to be seen and treated accordingly.
Right. Doctor, can a child have thyroid problems? If there is a sudden weight gain, do you advise to do a thyroid test? Child is about age of 10.
Yes. If he started, of course, first and foremost, as I said, is lack of exercise and abnormal food. But a 10-year-old, if he has suddenly started gaining weight, has become inactive, lethargic, is more sleepy, is finding the environment very cold all the time, he has developed intolerance to cold. When we check, he has developed some, features which suggest thyroid. Maybe there is a swelling in the neck, or features of hypothyroidism, or family history. If there is a family history that my mother has a thyroid problem, maybe because of antibodies, father is. In that case, definitely thyroid has to be checked.
Thyroid needs to be checked. Great, doctor. Thank you very much for that. As we are moving towards the end of the session, I will just take one more question and then we shall proceed towards the end, and we'll definitely have a takeaway message from doctor. Doctor, there's a question in regards to if we have shortness of breath without cough, fever, and cold, only shortness of breath, what should we do? Actually, this is more of a general question than a child, but let's talk about if the same situation is in a child.
If there is no cough and cold and just shortness of breath, you need to really examine the child. Maybe he's getting a bronchospasm and the airway is going into spasm, so that whenever he's taking a breath, it's not really reaching the lungs properly. Whether there is any asthma in him or in the family has to be looked at. As the child put on weight suddenly, then also it leads to shortness of breath. Boredom and anxiety also, many girls, especially in the age of puberty, because of the anxiety, they develop a ventilation which is like that short sign. We call it hysterical breathing. Yes, the child is to be seen if there is shortness of breath. It can be normal, it can be pathological, or it can be psychological.
Right, Doctor, the session has been very informative, and I've been requested by two of our followers who are actually commented. If you can just give answer to that quickly, we still have 5 minutes, then we will still proceed. The question is coming in from Mr. Asif, and he's saying, is thyroid problem can affect any child's education performance?
Definitely. Thyroid is a hormone which you need for brain growth, and that's one of the reasons why we check thyroid in all the babies when they are born. Because if thyroid is deficient, baby's brain doesn't grow very well, and they develop developmental delay in almost all the aspects. So definitely, so thyroid is important right from birth, in the preschool age group, school age group, even adults also. Brain growth is complete by about 8 years of age, but after that, brain activity needs thyroid in all the time.
So it's playing a vital role.
Most important for the brain function.
Absolutely.
Not only brain, other parts of the body.
Right. So I believe Mr. Asif has got the answer. Thyroid problem can, of course, it is affecting the child education performance. One last question, Doctor, coming up from our YouTube viewer, Ms. Sita Raj again, and I had type 2 diabetes during my second pregnancy. How will it affect my child's weight gain?
Type 2 pregnancy means a baby who is born to a mother with diabetes, they call it IDM, infant of diabetic mother, tends to be a large baby at birth because of the hormonal changes which have happened because of the mother's diabetes. And those babies tend to have large body mass and low sugars. So usually it leads to a large baby, LGA baby, we call large fertilization baby. That weight usually lasts for first few months, and after that it's baby's own diet, its own metabolism, and its own endocrine function, which leads to the normal weight. It doesn't predispose the baby to get diabetes, but yes, in the first few months of life or first few weeks of life, it can lead to a large baby.
Great. Thank you so much, Doctor. Doctor, if I'll keep on asking questions, this session won't end. Doctor, before ending up the session, I would request you to please give us a take-home message from this session, especially regards to the topic that we are actually following today.
Yeah, mainly about the obesity. Yes, obesity is something which should be prevented in childhood because it can lead to adult obesity. Childhood obesity, when it leads to adult obesity, follows all the complications, which can be diabetes, hypertension, hyperlipidemia, heart attacks, right? And the fatty liver, increase in the bone fractures amongst obese children. So lots of complications can occur if you don't control the obesity in childhood. How do you control? Most important is parents have to show what is healthy food by eating themselves. Parents have to show the children by exercising themselves. Like a child, who goes with the father for cycling every day, goes with the father or mother for swimming every day, definitely is unlikely to become an obese child. That's a very important message I want. And parents have to lead by example, prevent obesity, and second, of course, is stay healthy, fruits and vegetables. If an apple a day keeps corona away, remember that, and take your vaccines regularly and prevent corona. Safe distance, wear your mask, and sanitize your hands again and again.
Absolutely, absolutely. Thank you so very much, Doctor, for today's session. Before we end up the session, I would like to tell all our viewers who are currently watching us from Facebook and YouTube that Dr. Rajendra M. Joshi, specialist pediatrician with an extensive experience of 35 years, currently is practicing in Prime Medical Center, Jumeirah branch. You can always book an appointment with him by calling on the number that is appearing on your screen at this time. and you can book an appointment. Obviously, he's also available at the telehealth appointments also. So you can just call the number that is appearing on your screen, 0470700999, and book an appointment with him, and as per his availability. And definitely, I'm sure with this informative session, you and your all the parents would have learned a lot regards to the obesity in child and what is a healthy weight for a child. That was the information that was given by doctor. For more, obviously, you can visit doctor in Prime Medical Center, Jumeirah. So thank you very much, everyone, for watching us. We will be coming back again with another live session on the same topic, but in Arabic, by Dr. Rafia. She will be the speaker tomorrow at the same time, in the same place, and we hope to see you again. So thank you very much. Remember, we always say that Prime Medical Center, in Prime, we believe in personalized care personally, and that is what we are here to provide all of you. Thank you very much, everyone, for watching us. We will see you tomorrow again at 1 o'clock again with an Arabic speaker, Dr. Rafia. Take care. Bye-bye.
Thank you.